Hey, what's up, everybody? This is Dr. Steve Schlintz, and I want to welcome you back to another episode of Dental Practice Freedom Radio. And today we are going to talk about something that I have talked about on some previous podcast episodes and kind of alluded to, but really important concept, and that is who should be presenting the financial arrangements at the case presentation stage. I will tell you that this is one of the most difficult things for dentists to discuss, to talk about, to figure out in their office. Like, who should actually be presenting the fees? How should it be arranged? And what creates the most successful outcome? I know from clients that I've worked with, at some point or another, almost every client has asked me this. It's not as big of a deal if you are doing cases that are, a crown, or a couple fillings, or maybe even some quadrant dentistry, where most treatment plans are ranging anywhere between $300 and $2,000 or $2,500. You start getting beyond the $5,000, the $10,000 range. You have to have a system in place that allows that financial discussion to happen pretty naturally. And the reality is, when people ask me, how should I be doing this? There isn't one best answer to that question. And like everything in dentistry, honestly, the answer is it depends. And so what I want to do in this episode is actually talk about the different models you can ascribe to when it comes to presenting financial arrangements. And then what are some things you actually should be looking for that help the process out so you can create a system that makes sense to you. So to start, basically, there's a couple different schools of thought, and they all have merit to them. And I'm going to share with you the school of thought that I've personally ascribed to, but it's only because of the way that I handle things. First is that the dentist actually presents the fee and discusses the fee with the patient. To me, some of the downsides of that is it can get a little bit uncomfortable at times, so the dentist has to be really comfortable having those discussions. B, I've been told that one of the downsides is that it makes the dentist look bad and greedy and money hungry and kind of evil. I don't necessarily believe that, but it's a knock against that philosophy. 3 is it takes more time to actually discuss everything, and there will be a lot of questions that are asked. And unless the dentist is really familiar with financial structures and arrangements in their practice, it's probably not the best use of time for the dentist. But the benefits is that, to me, presenting the treatment fee to the patient and being able to live in that moment allows you to do 2 things as a dentist. One, it really sees what maybe some hidden objections are for the patient. And I can't remember the one podcast that I talked about this, but I've always asked that question. In addition to the money, what other reasons would you not move forward with treatment? Because money is always a smokescreen. And so if you can get beyond that money question, usually you find out that there's something else going on in the patient's life that isn't allowing them to move forward at that time. I don't want to get too far off topic here, but by being able to present that treatment option to the patient with the financial numbers, we now can be able to start to dig in a little bit deeper and get beyond the money question. Okay. Second, it allows for me a feeling of confidence in presenting something that I know would benefit from the patient. So I'm not taking my confidence then and hoping that a third party, whether it's an office manager or some other financial coordinator, is able to carry the same level of confidence that I have for this patient. And I know that confidence is one of the number one reasons that patients will move forward with treatment. If they're confident that you're confident in what you're doing for them is going to help them, they're much more likely to say yes. Okay, so that's option 1, is that the dentist actually presents the fee and they discuss the fee and all the financial arrangements. Okay. Second is that dentist presents fee, but somebody else comes in and talks about the arrangements and how that's going to work. Okay. So basically the dentist, if you guys follow baseball at all, there's a closer, which is the 9th inning pitcher, and the setup guy, which is in the 8th inning, right? And so the dentist almost acts as like the setup. They're the ones presenting all the fees, talking about how it's going to work, and then they bring in the closer that figures out how to make those numbers actually work for the patient. Okay. Pros of this is that it allows the dentist to have the discussion of money with the patient, so we're not shying away from it. I don't want patients to ever feel like I'm shying away from the treatment numbers that I'm presenting. But it also doesn't get me caught up in the minutia of, are they going to qualify for, third-party financing? How are they going to make these payments? Are they going to make payments at all? Are they going to pay everything up front? I don't have to deal with that, but I've still presented the number. Okay. The third option is actually presenting what needs to be done by the dentist, not presenting a fee, and let somebody else come in and present the fee in its entirety and work through that process independent of the dentist. Okay. So the pros of that is that the dentist doesn't have to necessarily talk about money at all. The cons of that is what we talked about before, where to me, if you're not presenting the numbers at all, you might be shying away from it, and the patient might pick up that you're not really confident in what it is you're doing, and you don't really want to have that money discussion with the patient. Okay, so those are the three. Dentist presents fees and works out everything. Dentist presents fees, then let somebody else works out the financial arrangements, or dentist walks out of the room and somebody else presents fees and financial arrangements. And so the question then becomes, which one makes the most amount of sense in your practice? And I have a very simple criteria for how you should handle this. To me, the person that is most comfortable discussing finances should be discussing finances. The one thing you do not want when you're talking about money is somebody that's uncomfortable with money talking about money. And if you've listened to some of my other stuff, you know that one of my biggest pet peeves, listen, the sales process, when you are going to present a large case, whether it's full mouth reconstruction, an all-on-4 denture, anything that's over 10 grand, these are the money makers in your practice, and these allow your practice to be incredibly profitable. So this is one of the most important things you're doing, is presenting treatment to patient at that level. And if you have someone come in and discuss financial arrangements that's not comfortable with money, that is a recipe for disaster, right? And so what I see all the time is, just think about this. The dentist, historically, let's say a dentist is on average making anywhere between $175,000 to $250,000 a year. They're probably going to be comfortable with the aspect of larger case fees, okay? But they delegate it to somebody who might be making $25,000 a year in your office, and they're presenting financial arrangements. And the financial arrangements have to focus around a $35,000 treatment plan. For a dentist, that's about 2 months worth of work, a month worth of work. For a office manager that might be making $25,000 or $30,000, it could be an entire year worth of fees and finances and all that stuff, right? And so what happens is, if the office manager is presenting that and they're subconsciously feeling like, that's a lot of money, I don't know if I do this, guess what's going to happen? The patient's going to pick that up. So you have to make sure that whoever is presenting money is the most comfortable presenting money. It's a really simple guideline, but so few people actually don't follow this. And if you're a dentist, I don't have the time to do that. Listen, if you don't have the time in your office to present a $30,000 treatment plan and have patients move forward, you probably need to reevaluate what you're doing in your practice, because that is the number one profit center in your practice, is getting patients to move forward when they're ready to move forward, and not dilly-dally and not delay everything. And you know, if you're listening to this, the patients will say, yeah, I'm ready to move forward, and it wasn't closed effectively, and the financial arrangements weren't working. So now the patient has to go home and think about it, which is fine. I mean, sometimes they're going to have to think about a large case. But once they get home, then they kind of waffle, and now you're following up with them for months, and it never moves forward. You've been there. That is costing your practice millions of dollars in your lifetime. You need to master this skill. And so if you can figure out who is the most comfortable talking about money in your practice, you should probably have that person take care of the financial structure, okay? So now I'm going to give you a couple examples of how this works. The method that I use is that I present numbers for larger cases. And for me, I define a larger case as greater than $5,000. I will present the numbers for those cases and just say, this is generally the structure of the financial arrangement. This is how we move through treatment. These are the phases. This is how much it's going to cost you. This is kind of how we break it down. And at any point you can go to here, but not here. Kind of give them a big overall picture. And then I'm out of the room, and I'll let somebody come in and figure out how to actually set that up that makes sense for the patient. I've presented the number, but I haven't worked out all the details. Okay. I've just found that that works the best for me. I'm confident, like, listen, it's going to be $30,000, but this is what we're going to do for you. And this is how we're going to do it. And this is the result you're going to get. I'm out. Whether they do it or not, again, I've presented the number, I show it with confidence, and I'm out of the room. Okay. Now my office manager can come in and figure out, okay, we have third-party financing. We have this. What does that look like for you? If you had to make a payment of $30,000, what would make sense to you? Okay. That's how I do it. I know some dentists and some other providers that are outside of dentistry that are, dealing with much larger cases, and they go through all the money themselves and they figure out what financial arrangements and things like that. If you're a math whiz and a numbers guy or girl, and you understand finances and how, really a master at sales, you probably should do that. Problem is, most dentists aren't masters at sales and closing and understanding these things, right? I'm still learning, and I feel like I'm pretty good at the sales and closing process. I'm still learning, okay? But if you're really good at that, you should probably be the one presenting fees and closing. And I know some dentists that don't want to talk about money at all. And there's some consultants that talk about that, like you shouldn't present fees. If you're not comfortable talking about money and you have these, and my clients know that I talk a lot about paradigms and belief systems. If you have belief systems about money that don't allow you to present the fee effectively, you should not be doing it. You're costing yourself a lot of money by doing that. Okay. I know dentists that completely get rid of that. And the reality is any one of those three options would work for you if you know what's working. So the second question is, like, how do you know what's best? Track the numbers. My clients have a very simple spreadsheet that I provided for them that basically allows them to track case acceptance over 5,000 and under 5,000. Very simple to use. It's not, you don't need high level software to do this. But you say, okay, any case that was over 5,000, what was our case acceptance rate? Any case that was under $5,000, what was our case acceptance rate? And if you know what your system is and you go and track the numbers, you can actually start to play around with, if I present everything, what happens? If I present half, what happens? If I present none of it, what happens? And then you're going to get a number, and you're going to have total amount presented and total amount accepted. And if you ran a test for 1 year in your practice and you figured out, okay, for 4 months, I'm going to do it this way. For 4 months, I'm going to do it this way. And for 4 months, I'm going to do it this way. We're going to look at all of the numbers and we're going to figure out which one worked the best. And that's the one we're going to go with. Very simple way. You can't subjectively look at these things. And I see that happen a lot with dentists. They have one case that's accepted and they use that as the basis for the entire career, right? It is no different than if you start learning comprehensive dentistry and the first 3 patients you presented comprehensive dentistry to, they said no. Guess what happens? If you don't understand the process, you'll say, I'm never going to do that again because they always say no. Well, that's not true. You probably weren't very good at it because you've done 3 presentations at that level. Or if somebody said yes right away, you now have a bias that worked and everything beyond that is going to be presented that way. And that might have been the one time they said yes. And now you're using that as the basis for the rest of your entire career about how you present treatment. I'm telling you that you pick a model and then you analyze it and you look at the data and you say, is this actually effective? You might find that if you present fees and you present financial arrangements, your case presentation success rate might be 80%. But if you had somebody else in your office that's good talking about finances present it, and they do the fees, they might find that it's also 78, 79, 80%. Now, if it's 78% and you're at 80, then you have to figure out on that 2%, how much money does that actually relate to over the course of a given year and 5-year period? What does that look like? And so over a 1-year period, if that comes out to $4,000 and you don't have to be in the room at all, it's a no-brainer that I'd be delegating that to the person that's actually in the office that's presenting the fees. But if it's $150,000 over the course of the year, then you have to decide, isn't that something that's probably better purpose by me presenting the fee because I'm getting $150,000 of additional revenue. So what I'm hoping you see is that there's different philosophies and they can all work for everybody. You just have to know which one is probably, you're making a hypothesis, right? We're applying the scientific method to our case presentation process. We're making a hypothesis that I feel like if we did it this way, it'll work the best, but I want to test these other models out too, just to reaffirm everything. We present, we analyze, we look at the data, and then we analyze the data in a comprehensive fashion, and then we can make appropriate decisions about our practice based on that data. So you're using every bit of your practice and your unique ability as a scientist to figure out what is the most effective way to bring more profit into this practice. Because at the end of the day, if you guys have listened to me in the past at any of the 125 episodes that I've done, you understand that I'm a big believer in comprehensive dentistry. I'm a big believer in having a practice that does more dentistry per patient, more meaningful dentistry per patient. The relationships are better. Just the level of fulfillment is better. You're not caught in this day-to-day cycle of just feeling like you're in a rat race. Some of my closest patients are the patients that I've done the most amount of dentistry for, and they're the ones that are by far the ones that love coming to the office. I love when they come to the office. It's just a great feeling. But in order to do that, you have to master some of these things. Like, how do I talk to financial plans with these patients? How do I set this up in my practice? And you can't do that haphazardly. You can't just guess and hope for the best. You have to be analyzing this. You have to be looking at your case acceptance rates. You have to be able to objectively measure what's working, what's not. And then you have to make decisions about your practice based on the data you're getting. So hopefully you got value out of this episode today. I know it was a little bit longer than normal, but we talked about some great concepts. Who should be presenting the fee? How should you be presenting the fee? How do you analyze the data as you present fees? And then how do you use that data to refine your process so that your case acceptance will go up in the future? So as always, if you get value out of any of these podcast episodes, I encourage you to leave a review or a rating. That helps me get to more dentists across the country. And if you're ready to start to dig into really building a more wellness-based, comprehensive-based practice, I encourage you, there's a link on the podcast episode bio to schedule a free complimentary coaching call with me. I'd love to know more about your practice, what you're doing, what you're working on, where you want to go in 2020 and beyond. And if there's something I can do to help you, then obviously we can talk about it at that point. So as always, have a great day, and I'll see you at the next episode.